I welcome you all to ET Health World webinar. To present this webinar, I welcome Dr. Vivek Nangia, Director, Pulmonology and Respiratory Medicine, Fortis Ranjandal Hospital, on the topic Moving towards preventive healthcare and adult vaccination. There will be a presentation on the topic, followed by a question and answer round at the end of the presentation. You may submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the question and answer session at the end of the presentation. Now I request Dr. Vivek Nangia to start the presentation. Over to you, sir.
Namaskar, dear friends and colleagues. A very warm welcome to all of you on joining this seminar this afternoon. Basically, what I'm going to talk about is something which is on a very high priority, especially for the adults, but is very often neglected because somehow over a period of time, as we grow, we tend to become callous and negligent about our own health. So what I'm going to discuss in the next 20-25 minutes is about what are vaccines, why the adults should be taking vaccines, what vaccines are relevant in the Indian context, and then how can we actually spread the message across and get more and more people to get themselves vaccinated. You know, you wouldn't realize, but vaccinations have been there for more than 200 years now. It has been recognized as one of the top 10 most effective public health interventions. In 2007, it was voted by the readers of British Medical Journal, a very renowned journal of the international medical world, as one of the 4 most important developments in the medicine of the past 150 years, alongside sanitary, antibiotics. Can we not close this? A vaccine is a biological compound which resembles a disease-causing microorganism. This has been either weakened or killed form. It could be the toxins, or it could be one of its surface proteins. It is then administered to an individual where it goes and stimulates the body's immune system. The body's immune system initially recognizes it as a foreign particle and then tries to control it, negate it, and destroy it. But then it remembers it. It develops certain memory cells which remember this antigen for times to come, so that whenever there is a subsequent exposure, the next exposure, it is able to counter it very well, control it very well, and destroy it in time, even before it develops into a full-fledged disease. The benefits of vaccination are that 1, it elevates the immune system, also that it prevents disease, reduces the severity, reduces morbidity, and also reduces the mortality because of the diseases. Vaccines were developed nearly 200 years back, starting from smallpox in 1796, then rabies, plague, typhoid, followed by diphtheria, pertussis, tetanus, so on and so forth. Over the years, with newer technology, novel mechanisms, the vaccines have also got improvised majorly. If you see the statistics from the USA, there has been a comparison of the vaccine-preventable diseases in the 20th and the 21st centuries. So before and after the introduction of the immunization program in children. And you see with immunization, we have been able to completely eradicate smallpox from this earth. The number of cases of diphtheria have also reduced significantly. Measles, mumps, pertussis have come down. Polio is also almost to the edge of near eradication, and rubella, tetanus are also significantly down. And all this has been possible only with the advent of vaccinations. Similar results have also been seen in Canada, where diseases like diphtheria and polio have been totally eradicated, and there has been a significant reduction in tetanus, pertussis, and this H influenza B infection, the Hib infection. So the benefits of childhood vaccination program are that they have been able to significantly reduce the infectious diseases. They have reduced the childhood morbidity and mortality, reduced cross infections, that is the infection spreading from one child to the other. Also somewhat been able to reduce the infection in the adults because of the herd immunity, and thus resulting in an increase in the lifespan. So our average survival has increased now. That is why if you see that right now our elderly population of 60 plus is about, I think, 8 to 10%. But look at this. When we talk of this 25 to 50 or 55 years of age group, which is the most economically productive age group, this burden is now increasing. This population is actually now increasing. Bandwidth is increasing, if you see. And in 2040, it will be even more. So the number of people surviving after the age of 25 is significantly increasing as our lifespans are increasing. Even according to this UNFPA report published in 2017, at present we are pegged at about 8% and are likely to touch about 12% in the 60 plus population in our country in the next couple of years' time, and which is only going to be rising in the years to come. So with the advent of better medical facilities, overall better improvement in the quality of life, the lifespans are also increasing now. So we are lining up with a population which is now, you know, in the economically productive age group. So are the vaccines only for children, or the adults also need the vaccination? If there could be vaccine preventable diseases in children which could be prevented effectively with the vaccination, then why not in adults? But the question that we think is, oh, we are grown up now, we don't need vaccines, we have enough immune system to be able to fight the infections. But is that really true? There are various compelling reasons that make us think that elders and adults also need vaccination. The first reason is immunosenescence, which is actually a reduced immunity in the elderlies. As we grow old, our immune system also weakens. There's a decline in the elements of immune response with T and B cells. There's enhanced pro-inflammatory cytokine production by the macrophages, and there's a decrease in the ratio of T helper and T suppressor cells. As a result of which, the elders present usually with atypical signs and symptoms. They have more frequent infections that they acquire. Usually, if once they acquire the infection, it's prolonged. It results in increased morbidity and mortality, and such infections keep happening more and more frequently and repeatedly. And this era of multi-drug resistant bugs, we know how difficult it is to be treating such patients, especially elders, where the immune response is also poor. Another reason is that with time, in certain diseases like diphtheria, pertussis, and tetanus, the immunity wears off. Initially, we're able to fight off these infections very well. Then with time, the immune cells again become tired of fighting these infections. So they gradually become less and less in number. So our immunity towards these diseases also reduces with time. So you need a booster shot to again uplift your immunity. Then there are certain other infections like the MMR, that is the mumps, measles, and rubella, which the adults need primarily because they can spread it to others. There is a disease which can easily be controlled and contained. Yet other diseases which can result in severe complications and debility. Herpes zoster is one of them. It's a viral infection which results in severe post-herpetic neuralgia. Neuralgia means severe pains, and the pains are more severe than even the angina or akin to the labor pains. Such severe pains. Besides, it can result in severe disabilities in terms of Bell's palsy, encephalitis, stroke, hearing losses. People can even turn blind if the optic nerve is involved. There can be facial scarring, keratitis. It could be in skin, resulting in severe pain, and also involve the other organs like heart, joints, liver. Yet there are certain other organisms which actually change their antigenic structure over a period of time. And influenza virus is the most prominent example of this kind of an issue that we face. The influenza virus has two types of proteins on its surface, the H and N proteins, the hematoagglutinin and neuraminidase spikes of proteins on their surface. which actually can undergo transformation over a period of time, thus resulting in various different forms of combinations of H and N, totally evading the human immune system. So when influenza A is genetically labile virus, mutation rates are as high as 300 times that of the microbe. When there is a minor change in their antigenic structure, it results in seasonal influenza. Whereas when there's a major change, it is called a shift. It then results in a pandemic infection. Why? Because when there's a major change in the antigenic structure of the influenza virus, the people do not have enough immune response to these kind of viruses because it's totally new for them. As a result, it spreads like a pandemic. So that is the reason why for influenza infection, you need to keep taking vaccinations every year, as the infection, the strain of influenza virus may change every year. One other reason that we need to advise vaccinations for adults is that as we grow, we acquire certain other diseases like diabetes, hypertension, chronic heart, chronic lung diseases. Alcoholism is something that starts to happen. And then solid cancers, hematological cancers, HIV, AIDS, all these kind of diseases make us more prone to catching certain infections. And one of the most prominent of these infections is the pneumococcal disease. Pneumococci have been seen to be 3 times more common in diabetics, 6 times more common in patients with COPD, bronchial asthma, and chronic heart diseases, 11 times more common in patients who are consuming alcohol regularly, and about 23 to 48 times more common in patients who are suffering with HIV, AIDS, solid cancers, hematological cancers, so on and so forth. So these diseases also impact our immunity adversely, making us more prone to developing these kind of infections. And pneumococcal infection especially is seen to be more common in elders, that is in the age group of more than 65 years. Those in the 19 to 64 years of age group suffering with diseases like asthma, diabetes, lung, heart, liver disease, or alcoholism, with conditions that weaken our immune system, HIV, AIDS, cancer, or damaged or absent spleen, with cochlear implants or cerebrospinal fluid leaks, and those who smoke cigarettes. This is the risk group or the high risk group of individuals who are most susceptible to catching pneumococcal disease. And pneumococcal disease, mind you, is associated with a very high morbidity and mortality, especially when it comes to meningitis and sepsis. The mortality touches almost 36-37%, which is a phenomenal figure. Yet again, there's a disease which can be prevented, and that is the cervical cancer. With effective vaccination now being available, the cervical cancer in the ladies can also be prevented. So these are the various reasons why a vaccination should be prescribed in adults. All individuals should be screened for vaccination. And a tool that we commonly use in our day-to-day practice is the HALO tool. Age stands for the health condition. Age is the A, L is for lifestyle, and O is for occupation. So depending on the health condition, age, lifestyle meaning whether the patient is traveling, not traveling, and occupation like us, healthcare workers, we are also prone to certain infections and should be taking their vaccination. Those who are dealing with animals, they should be taking the rabies vaccination, the prophylactic rabies vaccination. So based on all these factors, there was an expert group which had been formed and had come up with this recommendation way back in 2014 that for all healthy adults in India, a DPT shot followed by DT every 10 years, an MMR shot if it has not been received in the childhood, influenza for everybody more than 50 years of age, pneumococcal infection vaccination for those more than 65 years of age, and the high risk group, which I just explained, for human papilloma virus for 9 to 26 years of age ladies, and zoster for more than 60 years of age. Then in the high risk individuals, hepatitis B, A, meningococcal, varicella, Hib, typhoid, rabies, cholera, and Japanese encephalitis vaccines. So these are the vaccines which should be given to the high risk individuals. So again, this is a common chart that we see. This has been adapted from the CDC and the ACIP recommendations from USA. So depending on the medical condition like pregnancy, immunocompromised state, HIV, diabetes, asthenia, chronic liver disease, kidney failure, and the healthcare profession. So basically, based on these factors, you would consider giving them one of these vaccines and give them the as per the schedule. And then there's an age-wise recommendation also, that depending on the age of the patient, accordingly one could decide which vaccine is to be given at what time and at what frequency. Then Hajj is one common place where you get a huge lot of people collecting together. A lot of Muslims from across the world travel to Makkah and Medina at the time of Hajj. So in these places where they are staying in tents, so many people congregating together, they also become very prone to infections that spread from one to the other. So it's mandatory for such people to be taking the meningococcal vaccine, the pneumococcal vaccine, hepatitis A and hepatitis B. Another such gathering happens at the Kumbh Melas in our country. Again, there's a large group of people collecting together, almost in lakhs. There are inadequate civic amenities, inadequate sanitation facilities, and improper places for staying. So again, these people are very prone to catching infections. They should all be given a typhoid vaccine, a hepatitis A vaccine, and an influenza vaccine as a strong recommendation. The other optional vaccines are hepatitis B if the individual is staying there for a prolonged period, Japanese encephalitis, again, if the individual is staying for over 1 month, DPT, MMR, rabies, prophylactic vaccines could be given. Cholera is another thing that should be advised strongly to these people who are traveling for the Kumbh Melas. If we see the trends globally also, the adult immunization is quite neglected and under-publicized issue. Vaccine-preventable diseases cause unnecessary morbidity and mortality. And please remember, we're talking about the adults who are the economically productive age group. So once they start suffering with disease, then the economic productivity of the country, the nation also goes down significantly. There's inadequate immunization resulting in unnecessary costs, including those associated with hospitalization, treatment, and loss of income as well. In India, the situation is even worse. One, there's a complete paucity of epidemiological reliable data regarding the burden of communicable diseases. There's no focus on adult vaccination whatsoever, and the adult vaccination coverage is very, very negligible. In one of the renowned institutes of our country, this was a survey that was conducted, and what they found was totally shocking. That in diabetic patients, as I said, they are more prone to infections, but only less than 10% of them were getting the vaccinations for pneumonia and influenza. Out of the 28 physicians who were treating these diabetic patients, only 4 of them were aware that the patients needed to be vaccinated. And amongst the patients, 85% of them were totally unaware that there's anything like a vaccine also that needs to be given to them. This is the state that we're dealing with. So if you see, then what is it that we have to face when you think of vaccination? There are huge barriers. There's a lack of regular assessment of vaccine status. We are all struggling to see the patients in time, see them in the, there's large number of patients always in our outdoor clinics. So our focus is more on treating their current problem and not on prevention of something that can easily be prevented. There's lack of physician knowledge, and I would say lack of intent also on our parts in some ways. The costs are involved. When it comes to preventive measures, people usually come and say that, doc, there's cost involved. Maybe we could do it next time. So people tend to ignore it, avoid it, circumvent it. Sometimes you write a vaccine and the vaccine is not available. So there is sometimes the stock problem, supply problem. Also that in our country, there's a limited use of electronic records, tools, and immunization registries. So there is no way we are maintaining whether the patient or the individual has been vaccinated or not. And of course, patient hesitancy himself, that wanted to avoid the injections. It's unbelievable sometimes that grown-up adults also coming in saying, doc, we are scared of taking a vaccine. We are scared of taking an injection. So please let's just do without the vaccination for the current moment. There are various myths that are associated with these vaccines. The first myth that we usually encounter is that vaccines weaken the immune system. On the contrary, as I just explained, vaccines are supposed to enhance your immune system to be able to fight the infections better. The second myth that we deal with is that getting the disease is better than vaccination. Well, not really. The disease, besides causing mortality, if you survive the infection, it can also result in long-term morbidity and physical disabilities. There can be some irreparable damage which you may not be able to correct ever. There's another myth that people come up with, that vaccines are unsafe. And the fact is that most of these vaccines are pretty safe and only result in mild kind of reactions, mild local allergies, local swellings. That's all, which resolve on their own and do not even require much treatment. Another common myth that people come to us with is that vaccines have not been adequately tested. My friend, believe me, vaccines have been approved only after rigorous testings, and ongoing review of vaccine efficacy and safety is being established through various mechanisms. So it's an ongoing process. Initially also, they've gone through a rigorous mechanism, a robust mechanism of testing their efficacy, safety, and then even on an ongoing basis, they are being verified, the safety is being verified all the time. People also feel that they're not 100% effective. Well, yes, I agree they're not 100% effective. But if you see the studies, most people develop the immunity. 5 to 15% may not develop the immunity, but that's more of an individualized response. Again, what I feel is that for one individual, it's either 100%, or even if it is 70%, 80% that they've developed the immunity towards the disease, then the severity of the disease comes down, the frequency of the disease comes down. You know, for influenza vaccination, like when we give it to our patients, always we tell them that don't expect that you won't have another influenza infection in this coming year. But if it happens, the severity will be much less. And if you see, the frequency of or the intervals between two episodes will be prolonged. The frequency will be lesser. So these are the benefits of getting the vaccination done. Yet another myth that's commonly associated with the vaccination is that these vaccines are not cost effective. That means they're expensive. Well, this was actually a study that was published some time back, which actually looked through 11 other studies. 11 other economically, studies which are looking into the economic benefits of this pneumococcal vaccine. And they found that the majority of these studies reported that the vaccination of over 65 years old was a cost-effective and sometimes, in fact, cost-saving strategy for the prevention of invasive pneumococcal disease. So this vaccine is a cost-effective strategy for the prevention of IBD. Now the question comes is that how can we improve our vaccination, the spread of vaccination around us in the community? That's a three-pronged strategy I feel that we could adapt. One is enhance the access to vaccination services, increase community demand for vaccination. Let the patients come up, increase the awareness that the patient themselves come up and say that, yes, doc, we need to get the vaccination done. And incorporate physician or system-based interventions into practice. I'll just give you examples of all of these. So first thing that I recommend is that we should start running adult vaccination clinics. Just fix a day, fix a time, let's say between Tuesdays 11 and 1 p.m. I'll just be running vaccination clinic and not seeing the regular patients. For first month or two, nobody may turn up into your clinic then. But over a period of time, I'm sure the strategy will catch up and you'll start getting patients who come only in that period for vaccination alone. You could also train your paramedic staff to screen all the patients sitting outside in the waiting room while you're seeing the patient inside in your office. And they could screen whether the patients need the vaccination or not. It's not a big deal really. It's not very high tech, no rocket science involved. It's simple strategies, simple points that even the paramedics can easily cover. Take every possible opportunity to educate the patient about the vaccination. You could have handouts lying in your clinics, in your OPDs, which could be handed over to the patients for reading while they are waiting outside in the reception area. Then we need to reach out to the patients. Times have come where we've shifted on to technology now majorly. Technology is there in every part of our lives. Then why not into our practice as well? Mass communication through smartphones, WhatsApp, Facebooks, Twitters, text messagings, all this can easily be done now. There could be computerized reminders, and of course, not to miss out on the conventional methods like letters plus leaflets, a phone call, or a telephonic invitation to call the patients over. You could have posters like this in your clinic, which could help educate the patients. What we do in our hospital is we conduct pathshalas for the attendants who are waiting outside in the lobby area. So we go, we address them, and we enhance their knowledge on topics of common interest. Then, of course, one could use the media for this purpose, like this chat that we're doing today. There also the print media that could be utilized. We need to have more and more awareness. There are various apps and websites that one could easily refer to if we forget which vaccination is to be given at what time. What is important is to have a completely clear communication with the patients. One must assure the patients that recommendations are in their best interests. You should allow them to express their concerns and thereby increase their willingness to listen. Listen to their concerns and acknowledge them in a non-confrontational manner. Never try to show down the patient that he doesn't know about it. Well, yes, he's not supposed to know about it, and he may come up with some silly questions also at times. That is why we need to be patient, and we need to still convince him on the merits and the benefits of using the vaccinations. You could have standing orders in the hospital, like we have our specialty nurse with us in the unit who has been trained into looking into the indications and contraindications of the various vaccines that we would want to give to our patients at the time of discharge. So he goes, he assesses the immunization schedule, the status of the patient, and looks for any possible contraindications, and then administers the vaccine as per the protocol of the hospital. You could also have some provider prompts, like the electronic prompts in the medical records section. There could be notes in the charts, automatic pop-ups, a task to-do list, so on and so forth. These days with the technology, you can do anything that you want to. There's no limitation. This is a kind of software that I use in my own practice, where if you see vaccines is right at the top, that is the kind of importance that I feel we should give to vaccines. So has this strategy helped or worked? Well, yes. This was a study that was published a few years back, which has showed that when you link it to the electronic medical records, then the vaccination rates go up significantly. We unfortunately do not have such an advanced software yet, so we maintain our vaccination records on these charts that we have. There's a kind of immunization card and record that we've formulated for our patients. Of course, this is a slightly older version which has been updated now. So the question that would be coming to your mind is that, do these interventions work? Are you able to spread the message? Well, yes. According to this study that was published in 2002, the organizational change, like implementation of screening programs, standing orders, the ratio was almost 16 times probability that you would be able to convince the patient to take the vaccination. Then provider reminders, provider education, patient reminders, and patient education also significantly plays a major role in convincing the patients to take the vaccinations. There's also a Cochrane meta-analysis that has been published on the interventions that increased influenza vaccination rates of those 60 years and older in the community. And they found the three strategies which seem to be very effective in working. One was increasing the community demand for vaccination. That is educating the patients themselves that they come and ask you for the vaccination. Second is enhancing the vaccination access with the help of home visits, providing them free vaccines in times of epidemics and if possible. Then patient group visits to the physicians. And improving the provision by providers or the healthcare system, like reminding the physicians about all the patients, posters, postcards, educational outreach, feedback. So all these strategies have been shown to work towards improving the vaccination status of our patients. So to summarize, I would say vaccines work with the body's natural defenses to reduce the chances of acquiring certain infections and suffering from their complications. there are compelling reasons and evidence enough that why adults need vaccination. Every adult should be screened using the HALO tool, as I said, the health, age, lifestyle, and the occupation tool. Vaccines are safe, effective, and cost-effective too. We've had a very good childhood immunization program which has been fairly successful. Yet there exists a huge burden of vaccine-preventable diseases in the adults. So in order to close this gap, it's important to now have a robust adult immunization program as well. Let me end with this quote by Benjamin Franklin, that an ounce of prevention is worth a pound of cure. Thank you so much for joining in today.
Thank you, Dr. Vivek Nangia, Director, Pulmonology and Respiratory Medicine, Fortis Ranjandhal Hospital, for the presentation on the topic, Moving the Needle Towards Preventive Healthcare with Adult Vaccination. If you have any other questions, please send them at join@ethealthworld.com. It was an engaging and insightful talk and hope all the participants have enjoyed the session.